one of the things that I'm very proud of this course is it really brings together, some of the leaders at the absolute forefront of robotic reconstructive techniques and urologic reconstruction. And for me, I think, based on the programming, there are a couple highlights that I really want to kind of emphasize. The first is reconstruction of vesicourethral anastomotic stricture disease. As we know, this is a very common complication after, cancer therapies, oftentimes including surgery and radiation. And at the course, we're really going to have a great lecture series and also discussion of difficult cases regarding surgical management in this situation and also kind of bailout procedures of alternative techniques that can help surgeons in this setting. Another area that I am really looking forward to is in reconstruction of uretero enteric stricture disease. Um, this is a complication that we're seeing more and more of after kind of bladder cancer surgery. What we will be presenting on is kind of a framework and a reconstructive ladder to kind of guide treatment in the situation, and so that reconstructive urologists are well equipped to manage stricture disease of any length. I think one of the techniques that I'm really excited to learn more about is, free flap techniques within the lower urinary tract. This is a technique that Dr. Lee Zhao from NYU will be highlighting. And this is an area of strong interest for me because it really brings together the fields of plastic surgery and urology to really kind of advance care for our patients. So I'm really looking forward to this. I think one of the things that, as a reconstructive urologist, we see a lot of are these quote unquote unicorn cases where there's really no guidelines to direct therapies, and there's really no literature out there on how to manage some very complex clinical situations. And what this course really highlights, and what this session specifically highlights, is offering individuals a framework on how to think when they encounter situations such as this. What's going to be great is we do have some cases that will be presented by some of our participants this year. And additionally, we will have a thoughtful discussion on some of the most challenging cases that some of our faculty have seen over the past year. I think one of the most unique things about our faculty is the diversity of training experiences. I think we each of us kind of bring together kind of a different view when it comes to robotic reconstruction and training history. And so, we have Dr. Joel Buckley, who, trained under, legendary Dr. McAninch, and who was trained classically in open surgical techniques and was able to adopt kind of the robotic modality. We have Dr. Daniel Oon, who really comes from the endourology side in terms of having formalized training in robotics, but not in reconstruction. And then we have Dr. Zhao, who kind of has adopted single port, incredibly well, and has incorporated that flawlessly into his kind of clinical paradigm pathway. And then myself, who, I did classical training in standard reconstruction and also a separate fellowship in robotics. So I think all of us kind of bring kind of a unique take to the table. And I think this, really underlies the emphasis that, there's many different pathways to get to doing robotics in reconstructive urology. And it's a great thing because, the more opinions, the diversity in terms of clinical training pathways, I think that leads to a stronger product. One of the things I really wanted to take a little bit of time to highlight is the day before hands-on session. And so this year, for the first time, we're offering a very specialized, advanced hands-on lab the day before the conference. So 4 surgeons were selected to participate in this hands-on course. It's a cadaver lab involving both the single port robot and the DB5 robot. And so it's kind of meant to be a one-on-one training session. We're going to be focusing on intracorporeal urinary diversions. And we will also be focusing on retroperitoneal ureter reconstruction and extraperitoneal bladder neck reconstructive techniques, including transvesical and extraperitoneal techniques. And I'm really excited about this because, I really think this is a one-of-a-kind training opportunity where you really get to sit down one-on-one with an expert, our amazing course faculty, to really kind of refine and fine-tune your skills and ask questions. So I'm really, really looking forward to that.